Okay, so today we'll be talking about the female pelvis. So today we will learn about whatever the female pelvis bone is there. So what the kind of parts are there and what how this female pelvis is going to help during the labor. So we will see. So first of all, female pelvis. So the female pelvis, because of its characteristic, aid in the childbirth. So main function, or we can say the main part, we can consider as a female pelvis during the childbirth. When the childbirth is there, or even though the pregnancy is there, so that time this pelvis is going to provide the shelter to the baby. Okay, or even though it is providing a shelter for the reproductive organ also. Okay. So as it has written, the female pelvis, because of its characteristic, aid in the childbirth. So during the childbirth of this pelvis, this female pelvis, the bone is there that is going to help. Then after, it is a skeletal ring formed. So that is as you I have the bone also. So as you can see, this is the skeletal ring. Okay. So for a descriptive purpose, articulated pelvis is composed of the four bone. So for the descriptive purpose, so this bone, okay, I'm going to explain each one, whatever the parts you can see in this, I will explain about that. So mainly it is articulated pelvis composed of the four bones. So there are mainly it is composed of made up of the four bones. So that is the two innominate bone or the hip bone, that is known as a two ilium. So two innominate bone. So this both you can see, this one and this one, that both are known as a innominate bone, otherwise the hip bone also you can say, that is known as a ilium. Then after, the sacrum and the coccyx. So sacrum will be that the posterior part of the pelvis. So this is the this part is known as a sacrum, and this is the coccyx. Then after, so mainly whenever you are going to explain the female pelvis, so you have to take the pelvis at the chest level, then keep your palm of the hand, of the non-dominant hand you have to use, and keep at the this pubrosity. Okay, keep like this, and you have to explain with the pen. So this is the female pelvis, mainly is composed of the four bones, that is the two ilium, that is known as the innominate bone or the hip bone. Then after, the sacrum and the coccyx. Then after, here they have written about the joints. So these are united together by the four joints. So there are the two, mainly four joints are there. So two sacroiliac joint, So here the sacroiliac joint. So this is the sacrum bone and this is the ilium bone. So there is a one joint from where both the bones are connected with each other. Then after, sacrococcygeal joint. So sacro and the coccygeal joint, as we have seen earlier, they are made up of the four bones. So this four bones has to be united together, right? So that's why the four joints are there. So first we have seen two sacroiliac joint, right? So left and right. So both have the two joints. Then after, the sacrococcygeal joint. So this is the sacrum and this is the coccyx. So there is a one joining point or connecting point is there. So that is known as a sacrococcygeal joint. Then after, the symphysis pubis. So as you can see in the picture, or you can see in this model, this is a symphysis pubis and this is the pubic bone. So there are total four joints are there. Okay, now we will talking about the each bone, whatever we have seen now. So first we will talk about the ilium bone. So this is the bone we are going to talk about. So a large flared out portion of the innominate bone. So you can see, this is the in the female pelvis, this is the largest bone you can see, right? As you can see, it is a flared out. As you can see, it's have like a wing like a shape is there, right? So that's why it has said the flared out portion of the innominate bone. Then the upper border of the ilium is termed as the iliac crest. So upper border of the ilium bone. So this one, the border they are talking about, that is known as the iliac crest. Then after, the prominence at the front of the iliac crest is known as the anterior superior iliac spine. So this is the ilium bone is there. So we are talking about the anterior part. So this is known as the anterior part and this is the posterior part, right? So here, this is the point we are talking about. So this is known as the anterior superior iliac spine. Then after, a short distance below is known as the anterior inferior iliac spine. So this is that is located at the upper side. That's why it is known. That's why we have said that is a superior. But this one, it is we are talking about that is a inferior. Why? Because it is located at the below part. So a short distance below the and this one. So the short distance. So this one we are talking about, right? So that is the anterior inferior iliac spine. So this is the anterior superior iliac spine, and this one is the anterior inferior iliac spine. Then after, at the opposite end of the iliac crest, similar prominence are there. So similar, this was the anterior part and this was the posterior part. So what they have said, the iliac crest is there. So end portion we are talking, or the opposite portion we are talking. Okay, so that is the similar prominence are present, which are named as a posterior superior and posterior inferior iliac spine. So as you can see, here we are talking about this one, right? So this is the anterior, this one, okay, posterior superior iliac spine, and this one is the posterior inferior iliac spine, superior and the inferior, right? So 4 iliac spine we have talked about, anterior and the posterior one. Then after, the anterior surface of the ilium is concave in shape. So anterior surface of the ilium is concave shape, this one, and termed as the iliac fossa. So we are talking about this portion. So this, both the portion are known as a iliac fossa, and they are shaped in a concave shape. So we have talked about the ilium bone. Now we'll be talking about the ischium bone. So the thick lower part of the innominate bone, it has a large prominence known as the ischial tuberosity. So this is the largest bone, and we are talking about the lower portion. So this, both the portion, as you can see. So this is the this end part is a really thick one. Okay, so that is this, both the known as a this ischial tuberosity. Okay, so in sitting position, the body rests on the ischial tuberosity. So while we are sitting, okay, so that time the whatever the body weight is there, that is going to be rest on this ischial tuberosity. Okay, so a little above or behind the tuberosity projection is known as the ischial spine. Okay, so here they have talked what a little above. So this is the ischial tuberosity, right? So a little above. So this portion they are talking about. So this is known as the ischial spine. So both the ischial spine are there. So this one. Okay. Then after, in labor, the station level of the fetal head is estimated in relation to the ischial spine. So when the labor process is there and we want to know the station of the head, so that time we have to see this ischial spine. Okay, so this the ischial spine is there. So where the head is located, if it is the upper side and it is a lower side, so that is how, if it is upper side, the total -1, -2, -3, -4 portion will be there. From here, the ischial spine level is that we have to consider as a 0. So if the head is upper side, okay, in the this we can say in the cavity, so that time it has to be -1, -2, -3, -4. But when it is coming, when it is a true labor pain is there and good uterine contraction is there, okay, so that time what happened, the descent of the head will be there. So the ischial spine is that we have considered as a 0, right? So from, if it is down, so +1, +2, +3 and the +4. So by that you can able to know the station of the head, that is in the relation with the ischial spine. So that will help for the station of the head. So that we have talked about the ischium bone. Now we'll be talking about the pubic bone. So pubic bone from the anterior part of the innominate bone. So pubic bone, that is the anterior part. So this is the female pelvis, and this part we can consider as the anterior part, and this part the sacrum is there. So that will consider as the posterior part. So here what it has written, the pubic bone form the anterior part of the innominate bone. This innominate bone is there and they are forming the anterior part of the innominate bone. So it has the body and two or like a projection that is known as a superior and inferior ramus. So here you can see they are making one edge like circle, right? So this edge you can see, so that is a superior ramus and this is the inferior ramus. On the both the side it is present. Then after two pubic bone meet at the symphysis pubis. So this both the bone that is known as a pubic bone, right? So they are meeting at the center point. So that is known as a symphysis pubis. Then after two inferior ramus form the this pubic arch. So as we have seen, this is the superior ramus and this is the inferior ramus, right? So on the both they are making one this like shape, they are making the V shape, right? So that is known as a pubic arch, this portion. Then after the space enclosed by the body of the pubic bone and the rami and the ischial, that is called as a obturator foramen. Okay, so this portion, this is known as a obturator foramen. Okay, so that is near to the pubic bone, right? And the ischium. So this is about the ischium. Now we'll be talking about the sacrum. So sacrum we are talking, that is about this one, right? So sacrum lies between the ilia. So this is the ilium bone, between that the sacrum is located. So it is a wedge-shaped bone, consists of the 5 vertebrae fused together. So here what happens, these vertebrae are there, the 5 fused vertebrae are there and they are making the sacrum. Okay, this also they can ask in the table viva that how many vertebrae are fusing and they are making the sacrum. So the answer is 5 sacral vertebrae. Then after the prominent upper margin of the first sacral promontory. So upper prominence, so we are talking about the upper part. So here the round shape that you can see, that is known as a the sacral promontory, this one. Then after, the anterior surface of the sacrum is concave and referred to as a hollow of the sacrum. So here the anterior surface we are talking about, that is look like a concave shape. Okay, this is like a concave shape. Then after, refer to the hollow of the sacrum. Then after, 4 pair of the whole or foramen pairs are sacrum, and through this the sacral nerves are passing. As you can see, this sacrum have a holes. Okay, so that is known as a holes also, otherwise you can know as a foramen also. So from this hole the nerves are going to pass. Okay, so sacral nerves will be passing through this, all this these holes, or we can say the foramina. So this also they can ask why these holes are there. Okay, in the table viva they can ask. So you have to tell, from that the sacral nerves will be passing. Then after, the coccyx. So it is a small triangular bone with its base uppermost articulated with the lower end of the sacrum. So as you can see, it is in a triangular shape. Okay, why it have the 3 corner, that's why it is a triangular bone. Then after, that's uppermost articulated with the lower end of the this. So upper that this coccyx is there, right? Upper part is the sacrum. So end of the sacrum, that is making the coccyx, right? So during labor it moves backward and allow more space for the delivery of the fetus. So what happens when the baby is coming through this cavity? Okay, so baby will be in the true pelvis. First it will be in a false pelvis, then it will go to the cavity, then after it will come the out. So that time what happens, this coccyx, it is going to be backward, it will move backward. So by that what happened, they can create a more passage, so baby can easily pass through this canal. Okay, so we'll be talking about the pelvic ligaments. So which all are the ligaments are there? So ligaments, they are going to help the, or we can say the support the pelvis, right? So here the sacroiliac ligament, sacroiliac. So that is the name, it is only going to suggest the where the ligament is going to start, sacro and the iliac. So this is a sacro and this is the iliac bone, right? So the sacroiliac joint is there. So there is so above that the ligament will be there, right? Because 2 bones are there, they are connected. But if there is no any ligament is there, ligament what they are going to do, they are going to provide the support to the all the this bones. Okay, so the ligament passes in front of, so here the ligament will be starting from front side of the pelvis and it will go to the behind each sacroiliac joint. So it will pass from front part and it will cover the back side, so like the it will be at the surrounding. Okay, then after that is a sacroiliac ligament. So that will be 2, left and right. Then after the pubic ligament, so connect the top of the pubic bone. So here what happens, the top that is going to connect, because this pubic bone is there and this is a symphysis pubis, and they are connected, right? So there has to be one ligament, so that is a pubis ligament. So the arch pubic ligaments run under the symphysis pubis. So that this ligament that is going to cover the top part, and that is going to wrap, and that will come to the lower part of that, and that will be covering all the this symphysis pubis from all the borders. Then after the sacrotuberous ligament. So sacrotuberous. So this is the sacral tuberosity, right? So tuberosity and the sacrum. So here also one ligament is present. So one ligament runs from the sacrum to the ischial tuberosity. So from here, from one the sacrum, from there the one ligament will be starting, and they will be covering the ischial tuberosity. Then after the sacrospinous ligament, so one ligament on the each side. So here also two ligaments are there on the each side, left and right one. So of the sacrum and the ischial spine, sacro and the spinous. So ischial spine, that is also spinous, right? So the sacrum and the spinous. So one ligament will be over here. So left and the right. So there will be the two, one on the either side. Then after the sacrococcygeal ligament. So this is the sacrum and this is the coccyx. So this is the joint also is there, right? So that's why there has to be one ligament. So one ligament on each side from the sacrum to the coccyx. So here what it has written, sacrum and the coccyx. So one will be on the each side. So from here like this and then like this. So two sacrococcygeal ligament will be there. So as you can see here, they have given this just rough idea about that. So this is the right sacroiliac joint. So this is the here, and this will be the here. Then after sacroiliac ligament. So this is the sacroiliac ligament. Then after sacrotuberous. So tuberosity will be covering, and they will be going to the sacrum. Then after the sacrospinous ligament. So that will be the ischial spine is here. So from here to here. And the sacrococcygeal ligament will be here. So this is about all the ligaments, and total there are the total 5 ligaments are there. Sacroiliac ligament, second is a pubic ligament, third one is a sacrotuberous ligament, fourth one is a sacrospinous ligament, and fifth one is a sacrococcygeal ligaments. Okay, so now we'll be talking about the bony landmarks on the pelvic brim. So here we are talking about the pelvic this landmarks of the pelvic. Okay, so that will be present over the brim. So here the brim part, which is that, so one imaginary line you can see over the pelvic or on the pelvic bone. So that is known as a imaginary line also, you can say, otherwise the brim, otherwise the inlet. So it have a different names. It will be calling as a brim, otherwise the inlet, otherwise the imaginary line. So from anterior to posterior on the each side. So as I have told earlier, this is the anterior part and this is the posterior part. So landmarks will be starting from the anterior part and it will be ending with the posterior part. So from here to here we will start and will come to the posterior part. So first one is the upper border of the symphysis pubis. As we have seen earlier, the two pubic bone is there, they are going to end and they are going to connect it with the symphysis pubis. So this middle part is known as a symphysis pubis. So here the upper border of symphysis pubis, then after the pubic crest. So this is the pubic bone, right? So here the upper border, this border is known as a pubic crest. Here we have seen that is the ilium and it also have the iliac crest, right? Then after third one, that is this pubic tubercle. So pubic tubercle will be at this point. Then after pectineal line, so there is a one line will be that the sharp line you will be feeling when you have this pelvis in your hand. So that time one line you can feel, that is known as a pectineal line. Then after iliopubic eminence, when this line is ending, that time one prominent part will be there on the pelvic brim. So that is known as the iliopubic eminence. Then after the iliopectineal line, again one line is coming. So when the this eminence is ending, okay, soon after that one line is starting, so that is known as a iliopectinean line. Then after the sacroiliac articulation, so sacroiliac articulation, or else you can say as a sacroiliac joint also, joint and the articulation, both the names are there, you can use anyone, any of that, okay. So this, both the side, the joint is there, okay, so that one. Then after anterior border of ala of the sacrum, so this both the part, as you can see the wings like structure is there over the this pelvic bone, so this is known as a anterior border of ala of sacrum, okay. Then after the sacral promontory, so this is the middle part of the sacrum bone, okay, that is known as the sacral promontory. Again, this is the upper border of symphysis pubis, pubic crest, pubic tubercle, pectinean line. This is the iliopubic eminence. Then after this iliopectinean line. Then after sacroiliac articulation, otherwise it is a joint. Then after anterior border of ala of sacrum. Then after this is the sacral promontory. So as you can see, the green line they have shown on the picture. So that is the point that is known as a brim, and all these landmarks are there, or we can say located over this pelvic brim only. We have to come from anterior to posterior part. Now we'll be talking about the parts of the pelvis. So here the different parts are available, because as you can see that this is the female pelvis bone. So bone have each curve and all the things you can see. So it have a particular name also. So that we will see. So in that first one is the iliac crest. So this is the iliac crest. Then after the ilium bone. So this both, it is known as the innominate bone, otherwise the ilium. Then after the lesser sciatic notch and the greater sciatic notch. So where the ischial spine, you have to turn this like this, the anterior part, then you turn around and you can see the curve is there, okay, it is making a C shape above the this ischial spine. So this is known as a, this one, that is known as a greater sciatic notch, and this part, the lower part of that ischial spine, that is this one, that is known as a lesser sciatic notch. Then after the ischial spine, so this is the both the point, right, that is known as the ischial spine. Then after the acetabulum cavity, or here you can see the hole is there, okay. So here the femur bone is that the head of the femur bone, it is going to attach over here. So that is the acetabulum cavity. Then after the obturator foramen, as you can see the hole is there. So that is the obturator foramen. Then after anterior posterior iliac spine, anterior and the posterior. So anteriorly two iliac spines are there, superior and the inferior, anterior and the superior, right. Then after posteriorly also two are there, superior and the inferior. So total 4 spines are there. Then after the pubic bone, and this one is known as a pubic bone. So now we'll be talking about the false pelvis. Now what is the false pelvis? So the false pelvis is formed by the iliac portion of the innominate bone. So here what it has written, the ilium bone is there, right. So that the iliac portion, upper this both is known as the iliac fossa, right. So they are going to form the false pelvis. So the false pelvis is formed by the iliac portion of the innominate bone, and it is limited above the iliac crest. So from here it is starting until the iliac crest, that is known as a false pelvis. So its only obstetric function is to support the enlarged uterus during the pregnancy. So here what it is going to help in the obstetric, what? So this false pelvis, during the pregnancy, the uterus is there, which is going to provide a shelter or going to provide a home for the baby. So that is the point, or we can say that is the location where the baby is going to have a growth and development. Okay, so during the 9 months, the baby is going to stay inside the uterus only, right? So what happens, the uterus is going to enlarge because all the reproductive organs are located inside this, okay, inside this pelvic bone. So here the uterus will be there, that is going to enlarge according to the months. So here what is going to there, that it is support the enlarged uterus during the pregnancy. So that is going to provide the support for the uterus. Then after, its boundaries are posteriorly. If we talk about the posterior part, so that is the lumbar vertebrae. Then after, laterally, the iliac fossas are there. Then after, anteriorly, the abdominal wall is there. Okay, so this is about the false pelvis. Anterior, as you can see, the posteriorly what it is there, lumbar vertebrae is there. Laterally, iliac fossa. Here the fossas are there. Then after, anteriorly, the abdominal wall will be there. Now we'll be talking about the true pelvis. So this part of the pelvic is chiefly concerned to the obstetrician. So here it is mainly the true pelvis is concerned with the labor. Okay, so that is have the main function, we can say, of the true pelvis. So as it forms the canal through which the fetus has to pass. So the imaginary line was there, or we can say the brim or the inlet. So from above that part, that is known as a false pelvis, right? False pelvis. And this inlet is there, and below that part is there, this one part, that is known as a true pelvis. As you can see, the true pelvis, this sacrum is going to be backward, and by that the canal, the true pelvis is going to create a canal. So from there the baby has to pass. Then after, for descriptive purpose, it divided into three. So here the true pelvis, further it is dividing into three, that is the inlet. Okay, so this part, the inlet or imaginary line or brim, so that is the part we are talking about, that is the inlet. Then after, this one, so this is known as a cavity, and this one is known as a outlet. Cavity and outlet. So first we will talk about the inlet. So here the shape, it is almost round, that is a gynecoid shape. So with the anterior posterior diameter being are shortened. And okay, so here if we talk about the inlet, so inlet, this is only part we are talking. So that look like a mostly it is in a roughly it is in a round shape. Okay, so here they have we are going to talk about the diameter. So here the pelvic diameter will be in a three way. So if the whatever the diameter are there in a straight form, okay, so that is known as the anterior posterior diameter, or you can say the AP diameter. If it is located like this, so that is known as a transverse diameter. Okay, if the diameter are like this, okay, so that is known as a oblique diameter. So we will be talking about that. So other different shape of the inlet are anthropoid, android, and the pateloid. So here the main, or we can say the normal shape of the female pelvic bone, the shape is the gynecoid. If they ask which is the normal shape or size, we can size of the female pelvis, so you have to say that is a gynecoid shape. But which is the abnormal female pelvis, so that has to be anthropoid, then after android, and the pateloid. So now we'll be talking about the diameter of the pelvis. As we have seen earlier, the female pelvis mainly it is divided into two, that is the true pelvis and the false pelvis. So false pelvis we can call as the imaginary line is there, or the inlet, or the we can say the brim. So above that part, that is known as a false pelvis, and the below that part is there, that is known as a true pelvis, right? So true pelvis, further it is divided into three, that is the inlet, cavity, and the outlet. So we'll be talking about the diameter of the pelvis. So first we have to talk about the inlet. So inlet, it means this portion, right? So we are talking about the diameter of the just inlet. So in that, all this inlet, cavity, and the outlet are there. There are the three type of diameters are there. So whatever the straight diameter, that is the AP diameter. If it is the diameter is like this, that is known as a transverse diameter, and the diameter if it is located like this, so that is known as a transverse diameter. So first we'll talk about the inlet diameter. So in that first anterior posterior diameter, so it have another name also, anterior posterior diameter. So that is the true conjugate, otherwise the anatomical conjugate. So true conjugate, two names are there. Maybe in the exam they can ask you like that. Tell me about the true conjugate. So you have to understand they are talking about the anterior posterior diameter of the inlet. Otherwise they can ask, tell me the anatomical diameter or the conjugate. So where it is starting? So it is a distance between the midpoint of the sacral promontory to the inner margin of the upper border of the symphysis pubis. So where it is starting? It is a distance between the midpoint of the sacral promontory. So midpoint is this is the sacral promontory, and midpoint you have to take. From here, where it has written the inner margin of the upper border of the symphysis pubis. So this is the symphysis pubis, upper border we have to take, and the inner border. So this portion. So from here to here, this like this. So this is the anterior posterior diameter, or the true conjugate, otherwise the anatomical conjugate, and it measures about the 11 centimeter. So this is about the first diameter. So that is the true conjugate, or the anterior posterior diameter, that start from the midpoint of the sacral promontory to the upper border of the symphysis pubis. Then after, we'll talk about another, that is a obstetric conjugate. So in AP diameter, there are the 3 conjugates are there. Okay, so different we will talk about. So what is the obstetric conjugate? It is the distance between the midpoint of the sacral promontory. Again, we have to take the midpoint of the sacral promontory to the prominent bony projection in the midline of the inner surface of the symphysis pubis. So this is the symphysis pubis, right? So inner surface and the projection part. Okay, so there is a big point of the symphysis pubis. So that point we have to take, and from there, from here to here. So that is known as a obstetric conjugate. Okay, so that measures about the 10 centimeter. As you can see, we have taken the upper border, right? So that's why the diameter are longer. But here we are taking the inner surface, and we are taking the midpoint of the inner surface. So what happens? The diameter are being shortened. Okay, so that's why it is a 10 centimeter. Before it was 11 centimeter, now it is a 10 centimeter. Okay. Then after, diagonal conjugate. So what it is? It is a distance between the lower border of the symphysis pubis to the midpoint on the sacral promontory. So diagonal conjugate, again we have to take the same point, take the midpoint of the sacral promontory to the, this is the symphysis pubis, take the lower border of the symphysis pubis. So it measures about the 12 centimeter. Okay, as you can see, the diameter are being more larger here. Why? Because it is this point, we can say they are farthest, that's why. So here the 3 conjugate we have talked about in the anterior posterior diameter of the inlet. So it has a 3 conjugate. First is a anatomical, otherwise a true conjugate, right? So that was about the 11 centimeter. The second we talked about, so first was the true conjugate. In that we have to take the upper border of the symphysis pubis. In obstetric conjugate, we have to take the same point, midpoint, but we have to take the inner surface and the midpoint. So that's why it is a 10 centimeter. Then after, the diagonal, that we have to take the lower border of the symphysis pubis. So here we can say we have taken all the border, or we can say all the portion of the symphysis pubis, right? Okay, so that was about the AP diameter. So that was, every diameter was straight only. Okay, straightly it was starting. Now we'll talk about the transverse diameter of the inlet. So it is a distance between the 2 farthest point on the pelvic brim. So here we are taking the distance between the 2 farthest point. Farthest, why? Because they are far from each other. Okay, over the pelvic brim. So this is the pelvic brim. So here we are taking the transverse. So that's why the diameter will be like this. Over the iliopectinean line. So iliopectinean line is here, right? So that point. So from here to here. So that measures about the 13 centimeter. So this was about the transverse diameter of the inlet. Now we'll be talking about the oblique diameter. So there are the 2 oblique diameter. Oblique diameter will be like this, right? So it is right and left. So 2 oblique diameter, one right and the one left. So each one extend from the sacro-iliac joint to the opposite of the iliopubic eminence. So from where it is starting, joint we have to take sacro-iliac joint from here to the iliopubic eminence. So eminence part. So like this. So that is known as the oblique diameter of the inlet. So that measures about the 12 centimeter. So till now we have talked about all the diameter of the inlet only. Now we'll be moving to the cavity. So cavity, it is almost round in shape. If we talk about the cavity, so this is the brim area and this portion that is known as a cavity. So in that also there are the two diameters are there. So that is the anterior posterior diameter. Okay, so it measures from the midpoint on the posterior surface of the symphysis pubis. So here which point we are taking? AP diameter, it always will be straight. Okay, so here we are taking the midpoint, okay, on the posterior surface, otherwise you can say the inner surface, both the meaning are same. So symphysis pubis and the posterior surface you have to take. From there midpoint you take, and the junction of the second and third sacral vertebrae. So this is the sacral vertebrae. So this is the first, second and third. So second and third, the midpoint or junction you have to take. So from there to the midpoint of the sacral the symphysis pubis. So it measures about the 12 centimeter. Then after the transverse diameter, it cannot be precisely measured as the point lie over the soft tissue covering the sacrosciatic notch and obturator foramen. So transverse diameter will be mostly like this, transverse, right? So here what it has written here, this obturator foramen, right? This is obturator foramen, and the sacrosciatic notch will be here. So they will be covering the tissue. All the tissues will be there surrounding. So that's why maybe according to the physiology of the woman, this tissue and fat can be different from the woman's, right? So that's why this cannot be precisely measured. Why? Because soft tissues are there over that bony projection. Okay. So but still they have given the 12 centimeter. So roughly it is about the 12 centimeter. So in cavity it have the total two diameters. So in that AP diameter and the transverse diameter. Now we'll be talking about the outlet. So outlet is this one, right? So that is the most probably anterior posterior oval shape. So this is look like a oval in shape. So it have the total 3 diameters are there. Okay, so in that first we'll talk about the AP diameter, anterior posterior diameter. So it extends from the lower border of symphysis pubis to the tip of the coccyx. So here what point we are taking? Lower border of symphysis pubis and the tip of the coccyx. So this is how we have to take the AP diameter of the outlet, and it measures about the 13 centimeter. Then after the oblique diameter, measurement between the obturator foramen and sacrospinous ligament, and it measures about the 12 centimeter. Here we are talking about the oblique diameter of the outlet. Okay, so oblique diameter will be like this. So it measures from the obturator foramen. So this is the point we have to take. Okay, till the where they have said sacrospinous. So the ischial spine we have to take, and from this sacrospinous ligament is there, that is covering the spinous, the ischial spine and the sacrum. So this ligament will be here, right? So where my finger is there. So there midpoint you have to take. Okay, so from here to here, that diameter is there, that is known as the oblique diameter. So that measures about the 12 centimeter. Then after the transverse diameter, that is the bispinous diameter. Okay, transverse. So this is the outlet and the transverse diameter. So transverse will be like this only. So bispinous also. So it is a distance between the tip of the two ischial spine. So the ischial spine is there and that tip you have to take. So distance between the two ischial spine. Okay, that is known as a bispinous diameter, otherwise the transverse diameter of the outlet. So it measures about the 10 to 11 centimeter. So this is everything we have talked about the female pelvis. We have talked about the different different parts of this female pelvis. We have talked about the true pelvis, false pelvis, the landmarks. Okay, this question mostly they will be asking in this table viva. Okay, sometimes they used to ask in this this paper, or we can say the theory exam also, they write the diameter of the pelvis like that, but mostly this is concerned with the practical exam also. So thank you.